Okay, immunity to HCG. This is from pounds and inches from Dr. Simeons. I think I'm getting tired of reading. The reason for limiting a course to 40 injections is that by then some patients may begin to show signs of HCG immunity. Though this phenomenon is well known, we cannot as yet define the underlying mechanism. Maybe after a certain length of time, the body learns to break down and eliminate HCG very rapidly, or possibly prolonged treatment leads to some sort of counter-regulation which annuls the diencephalic effect. After 40 daily injections, it takes about 6 weeks before this so-called immunity is lost and HCG again becomes fully effective. Usually after about 40 injections, patients may feel the onset of immunity as hunger, which was previously absent. In those comparatively rare cases in which signs of immunity develop before the full course of 40 injections has been completed, say at the 35th injection, treatment must be stopped at once. Because if it is continued, the patient begins to look weary and drawn, feel weak and hungry, and any further loss of weight achieved is then always at the expense of normal fat. This is not only undesirable, but normal fat is also instantly regained as soon as the patient is returned to a free diet. We don't want that. Patients who need only 23 injections may be injected daily, including Sundays, as they never develop immunity. Okay, so those only needing to lose a small amount, you don't need to skip that one day. Okay. In those that take 40 injections, the onset of immunity can be delayed if they are given only 6 injections a week, leaving out Sundays or any other day they choose, provided that it is always the same day. Very important. On the days on which they do not receive the injections, they usually feel a slight sensation of hunger. At first we thought that this might be purely psychological, but we found that when normal saline is injected without the patient's knowledge, the same phenomenon occurs. Okay, menstruation. Underline, during menstruation, no injections are given, but the diet is continued and causes no hardship. Yet as soon as the menstruation is over, the patients become extremely hungry unless the injections are resumed at once. It is very impressive to see the suffering of women who has continued her diet. It is very impressive to see the suffering of a woman who has continued her diet for a day or two beyond the end of the period without coming for her injection, and then to hear the next day that all hunger ceased within a few hours after the injection, and to see her once again content, florid, and cheerful. While on the question of menstruation, it must be added that in teenage girls, the period may in some rare cases be delayed and exceptionally stop altogether. If then later this is artificially induced, some weight may be regained. Further courses. Patients requiring the loss of more than 34 pounds, which would be me, must have a second or even more courses. A second course, this is underlined, a second course can be started after an interval of not less than 6 weeks, though the pause can be more than 6 weeks. So you can take longer than 6, but you shouldn't take less than 6-week break. When a third, fourth, or even fifth course is necessary, the interval between courses should be made progressively longer. Between a second and third course, 8 weeks should elapse. Between a third and fourth course, 12 weeks. Between a fourth and fifth course, 20 weeks. And between a fifth and sixth course, 6 months. In this way, it is possible to bring about a weight reduction of 100 pounds and more if required without the least hardship to the patient. In general, men do slightly better than women and often reach a somewhat higher average daily loss. Very advanced cases do a little better than early ones, but it is a remarkable fact that this difference is only just statistically significant. Okay. Conditions that must be accepted before treatment. Okay. On the basis of these data, the probable duration of treatment can be calculated with considerable accuracy, and this is explained to the patient. It is made clear to him that during the course of treatment, he must attend the clinic daily to be weighed, injected, and generally checked. All patients that live in Rome or have resident friends or relations with whom they can stay are treated as outpatients. But patients coming from abroad must stay in the hospital, as no hotel or restaurant can be relied upon to prepare the diet with sufficient accuracy. These patients have their meals, sleep, and attend the clinic in the hospital, but are otherwise free to spend their time as they please in the city and its surrounding sightseeing, sunbathing, or theater going. It is also made clear that between courses the patient gets no treatment and is free to eat anything he pleases except starches and sugar during the first 3 weeks. It is impressed upon him that he will have to follow the prescribed diet to the letter and that after the first 3 days this will cost him no effort, as he will feel no hunger and may indeed have difficulty in getting down the 500 calories which he will be given. If these conditions are not acceptable, the case is refused, as any compromise or half measure is bound to prove utterly disappointing to patient and physician alike and is a waste of time and energy. Though a patient can only consider himself really cured when he has been reduced to a statistically normal weight, we do not insist that he commit himself to that extent. Even a partial loss of overweight is highly beneficial, and it is our experience that once a patient has completed a first course, he is so enthusiastic about the ease with which the, to him, surprising results are achieved that he almost invariably comes back for more. There certainly can be no doubt that in my clinic more time is spent on damping over-enthusiasm than on insisting that the rules of the treatment be observed. Examining the patient. Only when agreement is reached on the points so far discussed do we proceed with the examination of the patient. A note is made of the size of the upper incisor, of a pad of fat on the nape of the neck, at the axilla, and on the inside of the knees, the presence of striation or stretch marks, a suprapubic fold, a thoracic fold, angulation of elbow and knee joint, breast development in men and women, edema of the ankles, and the state of genital development in the male are noted. Wherever this seems indicated, we x-ray the sella turcica, as the bony capsule which contains the pituitary gland is called, measure the basal metabolic rate, x-ray the chest, and take an electrocardiogram. We do a blood count and a sedimentation rate and estimate uric acid, cholesterol, iodine, and sugar in the fasting blood. Gain before loss. Patients whose general condition is low owing to excessive previous dieting must eat to capacity for about 1 week before starting treatment, regardless of how much weight they may gain in the process. You know, I think I'm going to start this section in a new chapter. This is describing why you need the loading days. All right, gain before loss is the next chapter. See ya.